Hi, everyone. Welcome to the webinar today. We're going to give a couple minutes for people to join, and then we will get started in just a few minutes. Thanks for your patience. All right. Well, good morning, good afternoon, good evening, everyone. Welcome to today's webinar. We're really excited that you're able to join us from wherever you are located around the globe. My name is Sean Lassiter. I'm the Assistant Director of Learning and Development, and I'm helping to facilitate this session. I just wanted to cover a few notes about this session before I pass it off to my colleague Emily. Um, just so everyone knows, this webinar is being recorded, and then we will post the recordings on our website for people to refer back to at any time. Um, you can use the Q&A feature in Zoom throughout the lecture to ask any questions you have. There will be time at the end of the lecture dedicated to Q&A, and we'll address the questions at that time. So feel free to engage in the chat throughout the presentation. Um, because this is a webinar format, we've muted and turned video off for everyone except for the presenter. Um, and then at the end, we'll also post a link to a survey to help us improve these webinars for future learners. I'm going to pass it off to Emily, who's the main instructor for today, to let her introduce herself and get started with the session. Thanks everyone for joining, and we hope you enjoy the presentation.
Hello, everyone. My name is Emilie Maddison. As Sean said, I'm one of his colleagues here at IHME. I've previously worked as a data analyst and researcher on various teams, both on and off GBD, and I'm now working in a learning capacity, helping people all over the world learn about what we do here. So we are going to start with some slides, and then we're going to dive into the tool itself. If you choose to follow along interactively, we'll give you some time to log in and get started with that. So I'm going to pull my presentation up. We're a fairly small group today. Unfortunately, we don't have time for proper introductions, but if you wanted to drop in the chat who you are, where you're from, your research interests, or why you joined today, that would be really cool to hear from you. Let me just set my screens up. Perfect. So as you all should know if you're here, this training is on the GBD Compare tool, doorway to GBD estimates. So what we're going to do today is we're going to have a brief introduction to who IHME is and what the GBD study is for those of you that are new to it. We're going to have a discussion about what GBD Compare is, how to navigate it. We're going to run through a case study in exploring GBD Compare, and then we'll have a brief discussion at the end about priority setting, benchmarking, and how you can use this tool in some of your own work. So IHME is the Institute for Health Metrics and Evaluation, and it is an independent population health research organization based at the University of Washington School of Medicine. We are an institute of somewhere between 500 and 600 staff members, all over the United States and to some extent the world. I am currently in Los Angeles. So the GBD study is one of the largest collaborative research endeavors globally. It's a systematic scientific effort to quantify the magnitude of all causes of death and disability, risk factors, and clinical outcomes. It recently turned 30 a couple of years ago. There's a retrospective in Nature Medicine by our director, Chris Murray, about its history. And this underlying rationale is that everyone in the world deserves to live a long life in full health. And what we aim to do with the GBD is to measure what disables and kills people across different locations, across different years, ages, and sex, in the hopes that by measuring what is stopping people from living long lives in full health, we will ultimately be able to improve the health of people globally. The most recent GBD, so GBD publishes updates roughly every 2 years. So GBD 2023 just launched a couple of weeks ago. I imagine that's why many of you are on this call. And the capstone papers, the major capstone papers for this report were published in a special edition of The Lancet on October 18th. If you want to check those out, they're really great updates on global health. There are many other papers published on specific diseases or on specific countries or regions, which will be published both in The Lancet and in other scientific journals throughout the year. There'll be probably hundreds of papers written. So what does the GBD measure? The GBD, as we've sort of said already, it endeavors to be as comprehensive as possible. And that means that we measure 375 different diseases and injuries and a little more than 3,700 sequelae of those diseases and injuries. We have 9 impairments that we report estimates for, 88 risk factors for many of the diseases and injuries, and 46 etiologies, which in our parlance means pathogens, though etiology does have a wider definition in the wider medical world. We do this for 925 locations. So there are 204 countries that we make estimates for, countries and territories, and then we have a little over 600 subnational locations that we make estimates for currently about 20 countries. This includes any country with a population over 100 million, as well as smaller countries that we have direct partnerships with. We make these estimates for 25 age groups, ranging from fairly small neonatal groups of a week, the first month, first 6 months, and first year of life, and then 5-year age groups continuing up to the 95 plus ages. And we do this for 33 years, from 1990 to 2023, for males, females, and all sexes. How do we do this? So, as I mentioned, there's quite a few hundred people working for the Institute directly, but we also have an enormous collaborator network of just breached 17,000 collaborators in 169 different countries and territories globally. So you can see on this map, in the lightest green color, we have fewer than 5 collaborators in a country, right the way up to more than 200. And you can see there's quite a few countries where we have more than 200 collaborators. These collaborators help us by sharing data, critiquing our results, vetting models, publishing estimates, writing their own papers, especially on, their countries of expertise, engaging policymakers and more. And if you're not already a member of the collaborator network, we would love to have you join us. So you can find more information about that at healthdata.org, if you are interested in having a more formal relationship with us. All right, so that's who we are. What is GBD Compare? GBD Compare is an interactive online tool that we use to help the public and the scientific community explore our estimates. Because of all those many, many causes and risk factors and age groups and sexes, there are literally billions of numbers published with every round of GBD. And so the viz tools are a really great way to explore what otherwise would be sort of like an impenetrable fortress of data. We can use GBD Compare to analyze a whole host of different questions, whether that's about how diseases are changing over time, how trends compare between diseases, injuries, and risk factors. We can explore specific countries by age and sex. We can compare countries to one another. We can even explore regional and global trends across any of these metrics. And so, we really try to make this tool as flexible as possible, allow you to answer the questions that you have about global health, whether that is, what is the impact of COVID-19? I can tell you in our latest estimates, we're estimating 18 million people died between 2020 and 2023 from COVID-19. What is the top cause of non-fatal health loss in your country? Or perhaps what percentage of lung cancer deaths are attributable to smoking? And we're going to explore kind of variations on these questions later in this lecture. Oops, went back a slide. All right, so now we're going to dive into the tool, and hopefully it all loads for you. There was an Azure outage this morning, but it looks like it's up. So I'll give you all a minute to log on. If you've been on the tool before, but not recently, you do now have to register, make an account to view the tool, which is a recent security change we've needed to make. So I'll just give you all a few minutes. If you want to play along with me, you can, or if you want to sit and watch me run through the tool, happy to do that as well. Just give people maybe like 2 minutes to sign in if that's something they're interested in. And for the rest of you, if you're already logged in, a question I have for you is, what questions do you want to answer using this tool? So I'm about to run through an exercise in leading health burden. But if there's something you're really interested in, leave it in the comments and we'll have some time at the end to address, hopefully, or at least some of the questions that get asked. And Sean has just dropped the link to GBD Compare in the chat if that is useful to you. Just going to give people 1 more minute. Do let me know if you're having any trouble or if you need a little more time. Okay, so hopefully those of you that want to log in have. The landing page, when you open the link, you land here, and we are just going to go through the various navigational options we have first. So on the left-hand side, you see a control panel with lots of buttons. This manages all of the chart settings, things you might want to change. Right next to the word settings, you have this link, use advanced settings, and that allows you to switch to advanced settings, or if you click back to basic, it will take you back to basic. And we are just going to take a second going to go through what is in basic settings first, then we'll move on to the advanced settings. So the basic settings are sort of a trimmed down version of everything we have to offer. So you can look at cause or risk factors. You can look at the measures YLDs, DALYs, or deaths. If you're unfamiliar with YLDs, DALYs, and our other summary measure, YLLs, we have another great lecture going on this week on interpreting GBD measures, which can explain better what these measures are capturing. But just briefly, DALYs are a summary measure which estimates health loss both from premature death and loss from living with disability from any of the conditions that humans have. So it's sort of a summary measure that's trying to capture all types of health loss. We have locations, so all 925 locations are available, as well as some custom regional groups. So you can see this whole long list. If you click the little arrows, you can fold down if you're looking for a specific country. You can also type a country and it will search for those based on the keys you've put in. Using this slider, you can change the year that you're looking at from 1990 all the way back to 2023. We have 6 age groups, so all age, and then various child, teenage, young adult, and older person groups. And then 3 sex groups for males, females, and both sexes. I see there's a question in the chat. Let me just read this quickly. I will address that question later in the session, maybe at the end. Okay, so moving to advanced settings. If we click this advanced settings, we now have all of the options we had before, and we have some more. So as well as cause and risk, you can also look at etiology, impairment, and injuries by nature. Not frequently used by a lot of people, but depending on what you're interested in, might be worth exploring. And then as well as those 3 measures we talked about before, we also have YLLs, prevalence, incidence, and deaths. And actually, if I go to the map view, there's even more measures available. So we've also got maternal mortality ratio, probability of death, life expectancy, and healthy life expectancy. The same, sorry, going back to the tree map, just so we have that location. The same locations are available, same location groups are available, the same years are available using that slider. As well as those 6 age groups that we talked about initially, we also have all of the 5-year age groups and all of the other custom age groups that we make estimates for. And most importantly, I think most frequently used is this age standardized age group, which adjusts population level health estimates to a global standard population so that you can understand trends in disease independent of changes in the age of the population. If you want to know more about what that means, again, I would recommend checking out the Interpreting GBD Measures training that is happening this week. Same sex categories as before. We also have 2 more really interesting options in the advanced settings. And to understand these, I think it's important to note that the GBD organizes both causes and risks into a hierarchy where you have large categories followed by more detailed ones. So for example, at level 1, you have the 3 highest groups, biggest groups in our hierarchy, which are non-communicable diseases, then communicable maternal, neonatal, and nutritional disorders or diseases, and then injuries. And as you move through the levels, the overall buckets stay the same. You can see the blue squares and the red squares, the green squares, the same size, but each becomes more detailed. So level 2 causes are more detailed. Level 3, level 4 is more detailed than that. If you were, for example, only interested in one of these groups, the group section allows you to select. So if I'm only interested in non-communicable diseases, you can just look at those in the tool. Okay, So we've now gone through all of the settings options that are available to you. Now we're going to look at these buttons on the left. I've already given you a sneak peek by moving to map, but you can see there are about 11, I think, different graph options on the left-hand side. We're going to walk through each of these later in the lecture, but each of them have strengths depending on the question you're asked. Some of them are specific to risks. Some of them are great for looking at different geographies, like a map would be. We've also got line graphs, all kinds of things. We'll come back to that in a few minutes, though. We also have these three buttons at the top. So the default is the single, which means you're looking at one graph. Explore allows you to look at the map and another chart of your choice at the bottom. So right now it's defaulting to tree map, but if I go over to the left-hand side and, for instance, select this line plot, which is second from the bottom, I can change that graph. So I can now look at selection of countries and their trends over time while looking at the global map simultaneously. You can change the map settings here. So for year, if I want to change the year that the map is displaying, I could change it to 1990 if I wanted to. And if I wanted to change the countries that were displayed here, I would go down to the line settings and change those locations using the drop-down menu. We also have Compare. So Explore allows you to look at a map and any other chart at the same time. Compare allows you to look at the same graph across dimensions. So for example, if I wanted to look at a map or a line graph by sex, both of these are now sexes. By default, it's set, so they're both sexes. So this is the same graph. But if we scroll down on the left to top chart settings, I could change that to males. And then I could change the bottom chart to females. And now I can look at this set of countries over the last 33 years. And I can see, for example, in this green country, all-cause DALYs for females gets a little higher in sort of the noughties, 2007, 2008. You don't see that same trend to the same extent for males. Another point to note, both in all of them, is we have an info button in the top right-hand corner, which explains what you're looking at. And we have this sort of arrow button, which will maximize the plot that you're looking at. So if you just wanted to look at males or just wanted to look at females, you could do that and then return. I'll go back to the single map for now. The other set of settings I'd like to draw your attention to is up here in the top right. We have help, language, share, download, and account. Account just lets you log out, not that interesting, but the rest of them are really useful. So using help, you can provide feedback. You can send us an email if you find something that isn't working correctly. Maybe a map is missing when it shouldn't be. You can learn more details about the tool, more information about GBD. You can check out our publications, our collaborator network. This bottom button, to get training, is also really nice if you are sitting through this training and would like another refresher. We have an asynchronous training, which means you can do it whenever you want. It's not live. It goes through a similar training to this one, but at your own pace. One of my favorite features is we actually are able to offer this tool in 17 different languages. So to access those, you just need to click and it updates all of the text into that language, including if you look at the tree map, cause names are updated, everything is updated. We'll note that is partially supported by AI, generative AI. So yeah, If you see something that doesn't look right based on your native language, that might be an opportunity for you to provide some feedback to us. You can share any of the graphs that you're looking at using email, Facebook, Twitter, or there's copy link button. Obviously, there's many, many, many settings that you can look at. And if you wanted to share the specific graph that you were looking at, let's say I'll just pick a random with country Georgia. I can go up here. I can click the copy link button. That is now copied to my clipboard, and I could send that to somebody or save it for later. And it generates a custom URL. You can see it's ihmeuw.org/79ot. And if I go there, it should open the exact graph I was just looking at, which is great for scientific communication. Yeah, you can see Georgia in 1990. Much better than trying to tell a colleague which buttons to press when there's so many buttons to press. You can also download a screenshot of what you're looking at. Say you want to use one of these graphs in a presentation. You can click download screenshot, and it will download that image as a PNG for you. Goes into your downloads folder. So if you go click and open that file, you can see nicely formatted image in a PNG file for you to use. If you were interested in the chart data used to generate the image you are looking at, you can download that using the chart data button. That will download what you're looking at as a CSV. So you can see here, it's for that Georgia location I've selected, all the different causes, the values, the lower and upper bounds. And if you scroll all the way down, we also provide a citation for you at the bottom of that CSV so that you can cite the data that you are using correctly. If you were interested in more than just the data that you're looking at on a single graph, perhaps you want to use the data available to you for your own research, that can be accessed using the GBD results tool, which is also linked in the download option. That is beyond the scope of this training right now, but it is a really great tool for allowing you to download fairly large sections of GBD results for your own interpretation. Okay, so we've gone through all the settings options. Now we're going to go through how you might like to use this tool. So my question is, what is the leading cause of health loss globally? How does that differ across location, age, sex, and time? And what is the leading risk factor for the leading cause of health loss? So I am going to go back to the global map, tree map for 2003. So this is the homepage setting. And I'm actually going to go to level 3. So for those of you following along, I've got DALI's global 2023, all ages, both sexes, level 3. You know, actually, I misspoke. For the sake of starting here, we're actually going to go to basic settings. In which case it's DALI's global 2023, all age, both sex. So using this tree map, I can look at what are the biggest causes of health loss. Remember, DALI's are that summary measure of health loss globally. And I can see some really big squares for neonatal disorders, which make about 6% of total DALI's. Stroke is another big one at 5.6 DALI's. And then IHD here, I have 6.89% of DALI's. So that tells me that ischemic heart disease, or IHD, is the leading cause of health loss globally. Now, knowing that, I might want to know how that looks different across different locations. And a great tool for that is the map, which is that first one on the list. So if we go to the map now, Right now it's defaulted to all causes, but I'm interested in ischemic heart disease. I can click on the drop down and I can look for ischemic heart disease, or I can start typing it. Ischemic heart disease. And looking at all age, both sex DALYs, I can see that there's a real concentration of health burden from ischemic heart disease in sort of Central and Eastern Europe and Central Asia. What if instead of wanting to look at location, I wanted to look at how ischemic heart disease was performing compared to other causes? To do that, I would go down to the arrow diagram, which is the fourth one down. We're going to skip number 3 for now. We'll come back to that. Then we go down to arrow diagram. So this arrow diagram, I happen to know ischemic heart disease is a level 3 cause. So I'm telling you that. You can see cardiovascular diseases, but I know ischemic heart disease is a type of cardiovascular disease, so I'm going to move down to level 3 so I can see it. You can see globally, ischemic heart disease has increased from the 5th cause of DALYs to the 1st cause of DALYs since 1990, which is pretty interesting. So we've compared against countries, we've compared against different causes. But what if we want to do both simultaneously? What if we want to look at cause ranking and location at the same time? There's another great graph that we can use to do that. That is called the heat map. It's the heat map, a little out of order again. Sorry about that, but you'll understand why. It's the 8th one down. This sort of set of rectangles. Give it a minute. Um, Is anyone else seeing this? Anyone following along? Don't know what happened there. Okay, so we've already sort of said that Central Europe, Eastern Europe, Central Asia part of the world is the one with the highest rates of IHD. What I'm going to do now is I'm actually going to change the location group. So when you're looking at a heat map, on the x-axis you have all these different diseases, the leading causes of health loss. And then on the x-axis you have various countries, which are, there's a default set, but you can change them. So what I'm actually going to do is I'm going to clear them all. Sorry, that was a bit quick. Using the X in the far right of the select locations option. And then I am going to go into select location group. Oh, that. Yeah, sorry. Yes. And select super regions. Now, there's 7 super regions and 5 socio-demographic index groups. For the sake of simplicity, I'm actually going to make a custom grouping. So I'm gonna X out everything that has SDI in its name. So I'm going to X out SDI, low middle SDI, middle SDI, and high middle SDI. And you can see now we just have these 7 groupings. I'd already identified that this Central and Eastern Europe and Central Asia is the part of the world with the highest rates of ischemic heart disease. I'm again going to move down to level 3 so I can see ischemic heart disease. And what this graph is telling me, right, is that while ischemic heart disease is highest in this part of the world, it is still the leading cause of health loss in many different super regions. So I happen to know is high income, Latin America and the Caribbean, Middle East and North Africa, and Southeast and East Asia and North and Oceania are all really ranking really high for ischemic heart disease. Oh, and South Asia, sorry, first or second. If rather than South and East Asia and Central Europe, I was interested in a different region, I can click on the name of that region and it will reorder the plot for me. So if I was interested in South Asia, I could click there and see the top 25 causes there and how that relates to others. And you can see, there are trends. There's a lot of those high-ranking red, yellow, orange colors at the top of the graph, but we can also see values that stand out. Like in high-income countries, it's a really high health loss from falls. Might be interesting to think about why that might be. I can tell you it's probably because the high-income super region tends to be quite a bit older than the other regions, and older people are more likely to die from falls. Just gonna catch up with my notes for a second here. Okay, I'm gonna do my best to go in a easier to follow order now. So we've already looked at arrow diagram. We're gonna go to pyramid next. So what pyramid allows us to do is it allows us again to look over those different locations, but instead of looking across different causes, we're gonna look across the two sex groups. So on the left-hand side, we have males. On the right-hand side, we have females, and then we have these 7 horizontal bar graphs for each of the 7 super regions. And since we're exploring Central and Eastern Europe and Central Asia at the moment, we can look and we can see the difference in burden across males and females. And you can see it's quite a bit higher for males, and particularly those cardiovascular diseases are much higher for males than females. If I was interested in a specific cause, I can change that on the right-hand side. So there's a button for cause groups. You can also add a specific cause. You can cross out causes individually by clicking on the X's. You can also go down to the bottom and clear all of them if you want to start fresh. So in this case, I'm going to look at cardiovascular diseases. And I can see more clearly that really significant difference between males and females in terms of cardiovascular diseases. Now, of course, we were looking specifically at ischemic heart disease. If I want to see this in more detail, I can go ahead. Any name that's underlined is a link to more detailed groups. So if I click cardiovascular diseases, it now breaks that down into the 10 or 12 or so more detailed groupings that we see. And in this case, ischemic heart disease is the second darkest red grouping. So it's this sort of like true red here. And we can see in Central Europe, sorry, going down with DALYs of about 4,800 for females and about 7,200 for males. Perhaps rather than sex, we're interested in looking at age. To look at age, we're going to go right down to the plot right beneath the one, just looking at the patterns group. I'm going to change my location to Central Europe, Eastern Europe, and Central Asia. And I'm going to hang out still in this cardiovascular group. And the x-axis is age. So you can see the smallest age group, 0 to 6 days, all the way up to 95 plus. And we can see, unsurprisingly, ischemic heart disease is causing much more health loss in those older age groups. You can also explore other x-axes using this graph. So in the bottom here, we have these 4 tabs. We could look at across different locations, those 7 super regions. We could look across year for our location of interest, how it's changed. And we can look at differences across sex using a stacked bar chart. We're going to skip this circular pie chart for now. We'll come back to that in a couple of minutes. And we've already looked at the heat map. So the next one we're going to go to is the plot. And we can see cause, all causes. Let's change that to ischemic heart disease. DALYs, Central Europe, Eastern Europe, and Central Asia. All age, both sex, rate. And there we can see the trend since 1990 for Central Europe, Eastern Europe, and Central Asia. So we know ischemic heart disease is really high in this part of the world. We can also see there's been a pretty dramatic improvement in the last 20 years in this region. This, I think, might be a good time to move to the advanced settings. So if we click at advanced settings, it's going to save what we've already done. I'm just going to draw your attention to two options. You can turn uncertainty on or off. So these lines around each dot are the uncertainty intervals. Very important that we report for every point estimate in the GBD. But if for some reason you wanted to see the plot without it, you're able to turn that off. And we'll, in the next graph we'll see a particularly good example of why you might want to turn uncertainty off when you're examining these estimates. Let's turn it back on for now. This may also be a good time to look at age standardization. So I mentioned that the age standardized age group is available in the advanced settings. Can swap that here. And now we can say this improvement from ischemic heart disease in the last 20 years is not because of changes in the age pattern in this region. So independent of those age patterns in this region, ischemic heart disease actually improved even more than the all age group. Now, if I wanted to look, we've already looked at countries, how they compare using the map. And we're looking here at how Central Europe, etc., looks over time. But if we want to look at both of those simultaneously, we can do that in a line plot view. So if we move down one to the line plot, this now allows us to see that same line we saw in the plots for Central Europe, Eastern Europe, and Central Asia, compared against the six other super regions that we report on. And you can see that this kind of dramatic improvement that we're seeing in Central Europe is a lot stronger than it is in other regions, which is kind of interesting, right? It might be worth exploring more what is going on in this region that is resulting in a, from a peak of 7,400 DALYs down to 3,800 DALYs. That's nearly cutting health loss from ischemic heart disease in half in approximately 30 years. Much like the other settings, you can also choose to change the location groups you have here by Xing them out on the right or by changing them in the location settings on the left. We aren't going to do that right now. We'll leave these as they are. So we found something pretty interesting going on with ischemic heart disease. Maybe now we want to look at some of the risk factors, some of the drivers of that health loss. And so to do that, we're going to jump into one of those plots we skipped a little earlier in the session. We're going to go to risks by cause, which is that third one down. This graph is exclusively for risk factors. And you can see on the left, you have a category, all risk factors, level 1, blah, blah, blah. Right now, we're looking at level 1, which are the metabolic risk factors, the behavioral risk factors, and the environmental risk factors. Like cause, we have these organized in a hierarchy where each level gets more detailed. If I'm interested in seeing more detail, I can change that using the level feature on the left-hand side. If I just want to know what's the leading risk factor for ischemic heart disease, I might do that by changing the options on the right. So I'm going to do that. I'm going to clear selection, and then I'm going to search for ischemic heart disease. And I can see in this region of the world in 2023, for age standardized results, we can see that high blood pressure is captures the most health loss from ischemic heart disease. There are others as well. High LDL, lead. Just like before, if you see a risk that's underlined, that means there is more detail there, and you could choose to click on it, and it would take you to the more detailed groups for there. If you want to go back to the main list, you can click back in the top left. So, high blood pressure, leading risk factor for IHD in this region. How has that changed over time? So let's go again to that line graph that we looked at before. Now, instead of cause, we're going to select risk. And instead of all risk factors, we're going to search high systolic blood pressure, which we identified as the highest cause of death. Now, currently, this is showing ischemic heart disease attributable to high systolic blood pressure. So how many of those DALYs per 100,000 are attributable to high systolic blood pressure? If we want to look at how high systolic blood pressure itself has changed rather than its relationship to a specific cause, we can change the measure in the measure dropdown to summary exposure value. Summary exposure value is a scaled value between 0 and 100, where 0 is zero exposure or the minimum exposure possible, and 100 is the maximum. And you can see relative to other countries and across time how high systolic blood pressure is changing over time. If you are interested in learning more about what summary exposure values are, you can check out our methods appendices, especially for the DALYs and risk factors paper. And we can see there's been a slight increase in high systolic blood pressure in our region of interest, this dark red at the top. So changes in high systolic blood pressure are not explaining that drop that we're seeing in ischemic heart disease in that region. I mentioned before we can turn uncertainty on or off. It's currently off. If I wanted to turn it on, I can see these overlaps, which might make it a little trickier to see, but also really emphasize the non-significant differences between a lot of these regions in exposure to high systolic blood pressure. And you can see if I click on one, it'll bring it to the top. I think also if I click on one on the right-hand side, it will also bring that one to the top, if that's the one that you're interested in. But perhaps if you're wanting to see all of the estimates and their trends simultaneously, a little easier to see if you turn that uncertainty off. The last graph we're going to look at for risks is this pie chart that we skipped earlier. It's also called the overlap map. For this one, I need to go back to all ages from age standardized. I've got ischemic heart disease. We haven't talked about YLLs much, so I'm gonna stick with our summary measure DALYs that we have been examining. And you see this colorful chart. So we've already talked briefly about the different level one risk factors: metabolic, environmental, and behavioral. And what this is trying to capture is what type of risk factors explain ischemic heart disease and how much of it is unattributable to any risk factor. So in the red group, that this 17% can be explained by metabolic risk factors. In yellow, much less can be explained by environmental risk factors. And in blue, that 8% can be explained by behavioral risk factors. And then we have the combination, right? Because many people are exposed not just to high blood pressure, but also to air pollution, or not just to high blood pressure, but also to smoking. And so you can see those overlapping groups as well. So in orange, we have metabolic and environmental risk factors. In green, we have environmental and behavioral risk factors. Purple, we have metabolic and behavioral risk factors, which brings us to the last two pieces. The center one, which is all three, metabolic and environmental and behavioral risk factors explain about 24% of burden of ischemic heart disease in this region. And then a little hard to see in this one, this really skinny light gray circle on the right-hand side is the unattributable burden. So how much of ischemic heart disease cannot be explained by any of the risk factors? Ischemic heart disease is particularly driven by risk factors, and so only just a little more than 6% of ischemic heart disease is unattributed to any of the risk factors we measure. Just to highlight this, I'm going to change the cause from ischemic heart disease. I'm going to scroll all the way to the top and go back to all cause. So looking at all causes attributed to all risk factors, which is sort of a confusing concept, you can see that light gray unattributed burden increases significantly. And about 51% of health loss from all causes is unattributable to any of the 88 risk factors that we look at. Okay, so that wraps it up for risk factors. And we just have one more graph. I know we've looked at so many graphs in the last hour together. Last graph is the last graph on the list, which is the decomposition graph. And this graph specifically explores our life expectancy estimates. So on the y-axis, we can again see our 7 super regions. The solid black bar on the left, we can see life expectancy in 1990, and the dashed line on the right, we can see life expectancy in 2023. And we can see across the board in the last 33 years, there have been amazing improvements. Still a lot of differences across regions, which is very sad, but amazing improvements in life expectancy in many of our lifetimes. You can see the decomposition, so the different colors are how much of this change can be explained by which cause of health loss. And so we can see a lot of red, for example, in sub-Saharan Africa, where there have been amazing improvements in maternal and neonatal disorders, in communicable diseases, etc. And if we go down to our region of interest, Central and Eastern Europe and Central Asia, we can actually click and see in detail how many years are explain this shift. And we can see cardiovascular disease, improvements in cardiovascular diseases have added 2.69 years of life to life expectancy in this region. You might ask why there is some health that's kind of below the black line and above the dashed line, and that is because of causes of health loss that have actually worsened over this time period. So if it's below the black line, these are the ones that have gotten worse. In this region, self-harm and violence has actually worsened in the last 33 years. And again, if we click on this, you can see that. So the negative decreased life expectancy and the years assigned to each of the causes that are worsening. This one's got a bit of a more complicated graphs. I think super interesting, though, to see how those changes. And you can see one thing I'm not sure I mentioned at the beginning is the way we use color in this tool. So the red ones are those maternal, neonatal, nutritional, and communicable diseases. The blue is non-communicable, and then the green is injuries. So you can see nice differences in trends across those different regions. Okay. So we've already explored at the very beginning, we talked about how you might want to share, how you might want to use these estimates in your own work by sharing screen links, by downloading screenshots or the data. I also want to draw your attention to one more advanced setting, which I know people love. We're going to go right the way back up to map, and we're going to be in advanced settings. So shouldn't say basic. It should say basic here because you're in the advanced settings. We're still in all cause. Doesn't really matter. Well, let's go back to ischemic heart disease. Let's practice. So ischemic heart disease. We're going to go back to cause for simplicity. Dallies again, 2023, all ages, both sexes, rate. If I'm only interested in this region of the world, maybe I want a map just of that region of the world. So if I scroll down here to location isolation, I can select locations and it will highlight or isolate that region. So in this case, you can see that Central and Eastern Europe and Central Asia region is more colorful. You can change that using the opacity. So more opaque is fully colored in, less opaque is fully transparent. If I wanted to, there's a little bit of Russia here on the left, but if we wanted to zoom in, sorry, Far Eastern Russia, we could zoom in and see just that region. Or if we're really not interested in the outlines of neighboring countries, you can click isolate and it will show you just that region. Perhaps the most useful use for this is looking at subnational locations. So let's X out of that. We go back to the whole country. And here we're going to touch on this detail chart, which we haven't discussed yet. So level 1 is countries and territories. And then as you add more detail, it starts breaking countries into their subnational locations. So you can see now lots of countries with states or provinces or regions available. And for our sake, let's just go to the most detailed grouping, level 4. Now, let's say I am interested in Indian subnational results. I could type in India, make sure it's selected to isolate, and now I have a map of the country I'm interested in by the state or region level estimates. I know people really like these, so if you wanted to download just this, you can go ahead, download that screenshot, and that's available to you and any work that you might be doing. Okay, so I am just going to stop sharing my screen just for a second so I can jump back into my presentation. This is we're going to start moving into the benchmarking and priority setting sections of this lecture. So again, I invite you, if there's anything that you're interested in, you have any questions that have come up, please drop those in the chat because we will be able to take those questions pretty soon. Okay, so just to recap, we've explored all these different graphs and talked about the different uses they have, right? So each of these graphs have strengths for different questions, whether that's comparing countries, causes, risk factors, time, age, sex. Life expectancy, we looked at that custom decomposition graph, but life expectancy estimates are also available in the map view, plots and lines. And we certainly didn't explore every single option here, but just to give you a taste of what is possible. I try to draw your attention. We only looked at DALIs today, but I just want to re-emphasize how many different measures are available in this tool. So we have all-cause deaths, deaths by cause, the maternal mortality ratio and probability of death. Those are all of our mortality estimates. We also have morbidity estimates of prevalence and incidence, summary measures of health, life expectancy, healthy life expectancy, years of life lost, years lived with disability, and then our all-encompassing summary measure, disability adjusted life years. And then for risk factors, we have population attributable fractions available for each of those 3 summary measures, YLLs, YLDs, DALIs, and deaths, as well as those summary exposure values. If you have any questions about any of these measures, I would again suggest that you check out our Interpreting GBD Measures lecture this week. There are also a few more of those coming up in December if this week doesn't work for you. Um, Also check out our methods appendices and our website for more information. So I just want to summarize what we went over for IHD because we covered a lot, right? So my opening question was, what is the leading cause of health loss globally? How does that differ across geographies, time, age, and sex? And what is the leading risk factor for the leading cause of health loss? So the leading cause of death and health loss globally is IHD. It is particularly concentrated in that Central Europe, Eastern Europe, and Central Asia region, but it has seen substantial improvement since 1990. High systolic blood pressure is the leading risk factor for this cause, but it doesn't explain the drops in IHG that we've seen since sort of 2000, 2005. And so my next question might be, did changes in other risk factors better explain the drop in IHD in the super region? So I might go in and explore trends in other risk factors to try and see, is anything driving this cause that we can explain? Which brings us to benchmarking, priority setting, and planning. Obviously, I think obviously this tool is a lot of fun. There's just a ton available to look at. It's really fun to use, but we really encourage people to use it in their work, in policy making and priority setting and exploring research questions. So priority setting is choosing health interventions to maximize health impact by choosing interventions that are based on existing health challenges in a population. We can do this comparatively by examining health outcomes and performance compared to different groups, whether that's in neighboring countries, whether that's different age groups, and using that to identify the best policy and program needs, the most effective use, limited resources especially. Now, this is generally pretty difficult, right? Health estimates are very rarely comparable, and because they're often measured by different groups or in different ways, true differences in health outcomes can be really difficult to identify. And those are the two big problems that the GBD tries to address. And so we're offering this solution of a systematic, standardized framework where population health estimates are more comparable across time, across location, independent of how individual data sets may have been measured. So as an example, this paper was published 2022 in The Lancet, and it was an exercise in priority setting for Nigeria. So these authors examined Nigeria's burden of disease and benchmarked it compared to other regions in West Africa, and found that Nigeria was lagging behind other Western African countries despite higher health expenditure, and made a call of action to focus on WASH, air pollution, and malnutrition to reduce this burden of disease. So this is one example of the way these results can get used. We examined a cause perspective. It's kind of one way of thinking about it. So we looked at IHD and asked, where is it the worst? But you could also look at a specific country or a specific age or any of the other sort of dimensions we've looked at. So from a country perspective, maybe you're really interested in a particular country, maybe you work for a particular country and you want to know what are the leading causes, what are the age groups that are suffering the most, how are trends in disease and health loss in different ages changing over time. So you might frame it from a country perspective. You should also do that from an age perspective. So maybe if you're really interested in under-5 mortality or childhood diseases or health loss in older populations, you could examine the same sort of questions that we're asking through that lens of age. I just went over this, but these are the sort of like 3 kind of ways you can think about framing those questions you might want to ask. And so I know I have asked a couple of times, so it looks like there might be 1 or 2 questions in the chat, but if there are any things you want to look at, we've got a good 20 minutes or so to take questions and explore the tool ourselves. I might just should I go through GBD resources now and then do that, Sean?
Sure.
Okay. So just want to draw attention to the wealth of resources beyond this training that are available to you. already touched on those capstone publications that were just published, the other Learning Week webinars that are going on this week, as well as GBD Compare. There are a ton of other visualization tools on our website that you can look at. Updated data sets available through the GBD results tool, media resources, including kind of one-page quick facts for various countries and causes, loads of stuff available on healthdata.org. Those lectures that I was talking about, we have this one, Learn to use GBD Compare. We also have a summary of the GBD 2023 results and impact from those results, a really nice summary of the major capstone papers. And then, as I've mentioned a few times before, guidance on interpreting the various measures and metrics used in the GBD if you are new to those. QR code in this slide deck should work for you to get to Learning Week resources. We also have a learning center where we have all of the resources, quick start videos, a set of core skills and third-party training resources if you want to learn more in this field, as well as information on future workshops and even degree programs, which we host too. Oops, and that is the end of the deck. So I think now we can move on to Q&A.
Thanks, Emily. There is a question here. I'm exploring GBD Compare from December 2024. When I get to know all the tools, I was ready for a paper. The time for publication. It looks like this person is asking about what data they should be using and when, what years of data they should be using and when.
I would suggest they talk to the scientific communications team about this, so scientific publications team about this, and perhaps we can follow up with you outside. I would suspect that since GBD 2023 is now published, those are the ones that should be available. And barring a couple of summary locations, I think all of those are up to date. I think it's all available in GBD results tool. But I think if your question, and maybe we can point you to people that can answer more definitively.
There's another question here. If I'm doing a single country study, let's say malaria in Sierra Leone, should I use the basic or advanced settings? Can I also use compare to get all the results, or should I also use GBD results tool?
That's a great question. So I am going to go to the results tool. So should you use the basic or advanced settings really depends on what you need. Depends on the measure that you're using. It depends on the ages that you're using. I would imagine if you're interested in your country over time, you're going to need age standardization. So I pretty much always go to the advanced settings because all of the options are available there. GBD Compare, the download results tool is useful for the exact graph you're looking at, but if you want more results, you should go to the GBD results tool, link available in the download option. You can also just go to the thing. You do have to sign in. And you can select a whole host of measures, metrics, causes here. So you can actually download larger data sets using the GBD results tool. So I would say both. You can also see there's another question. Kind of curious, what would you attribute? Sorry, Sean, I should let you read it.
Oh, that's okay.
What would you attribute the undulating trend from 1990 to 2006 to 2006, referring to IHD DALYs for Central Asia shown. This dip here. That is a great question. I might like to look at the specific countries in this region to answer that question, because obviously there's a lot that goes on. So if I go down, so I'm in location group here, and I'm going to click Central Europe, Eastern Europe, and Central Asia. And I can see the sort of next region down, which is different regions. And I can see that trend is mostly in Eastern Europe. So I could then go to Eastern Europe in the regions thing, click Eastern Europe, see all those countries in Eastern Europe. And I can see that's happening in Ukraine, it's happening in Russia, it's happening in Lithuania, but not every single country, right? I would imagine, especially this really big drop post 94 in Russia, has probably got something to do with the fall of the Soviet Union. But I am not an expert in IHD. But that's kind of how I might start examining it. Dial down to a specific country, think about what I know about what was going on in that country in those years. How are the data weighted to be globally representative? I wonder if you were referring to my comments about using like an age standardized global population. If that is not the question you're asking, please, if you could provide more detail. But assuming you're talking about age standardization, I will do my best to do a very brief explanation of this. So we all know that different parts of the world have different aged populations, right? So if I'm looking, it doesn't really matter what I'm looking at. If I'm looking at a map, I'm going to go to level 1 detail just for clarity. So looking at countries of the world, I know there are countries where there are a lot more younger people in the world. I know there are parts of the world where there are a lot more older people in the world. And what age standardization does is it takes the global average population pattern for countries with more than 5 million people. And so that pattern might be that there's there's not very many older people, and there's more middle-aged people, and there's a lot more younger people. And it makes it so we adjust every age group in every other country to match that population. More information about that is available in the Interpreting GBD Measures deck. But I can, for example, when I go from all age to age standardized, I'm going to see a very different sort of health pattern, because I know that Eastern Europe, Central Europe, and Central Asia is a quite old part of the world. So a lot of older people in Eastern Europe. When you look at age standardized results, you're saying like, okay, wow, there's a lot of ischemic heart disease going on in Egypt, which is sort of being masked by their younger age group. How is GBD data different from the DHS data? That is a big question. I would recommend you explore additional resources that we have, including Intro to GBD, which is available as a online training. But GBD uses as many data sources as we can get our hands on. So we absolutely use DHS data. We also use census data, survey data, we use hospital records, we use verbal autopsy data, we use environmental surveillance data, we use cohort studies to help estimate risk factors. We use just hundreds of different types of data. And so the GBD's strength is leveraging all of the data that is available to us, not just one DHS survey, in order to make estimates for all these different measures and causes. But I highly recommend you check out additional resources about that, because we've got some great lectures and courses if you want to learn more about how all this works.
There's another question about how is GBD data different from DHS data?
Yeah, sorry that I just answered that
Oh,
one.
sorry.
It's okay.
There's another question here about third graph to the last illustrated it better. I think maybe they're referring to a question above.
The graph that's illustrated. Oh, the dip better. We go down to this undulation pattern. Yeah, I mean the dots here are also, I mean it's the same line, oops, that is available, just joined up in the line graph. In fact, if you just like don't really like the dots, you can also get the same thing if you just select one country in that line graph. Yeah, I don't know why that undulation is happening. I need to talk to the cardiovascular disease team to answer that for you.
Well, we will hang out for a few minutes if there are any further questions. Thank you everyone so much for attending. We really hope that you found this session um, helpful in using GBD Compare, which is such a powerful tool. Um, we have a quick evaluation that we ask people to complete just to help us improve these sessions for future learners, and I will drop that link in the chat for everyone. If you have any additional questions, please do let us know. We'll stay on for a few minutes and try to get those answered for you.
Could is this, are we following the same question? Abiola, the trend, could it be related to data availability? We do our best to make adjustments in GBD estimates for data availability. That's one of the reasons why we use so many different data sources. So I wouldn't imagine that decreases in data availability would necessarily mean a dip in counts, because very briefly, we start by estimating global mortality. So we make estimates of like all cause death, how many people died in the world, which should, especially in some parts of the world, fairly easy to get accurate estimates of, especially parts of Europe that are just, it's very difficult to die and not have the state know that you've died. So I wouldn't imagine those mortality estimates have changed because of data availability in that region. We then go down from that all-cause mortality, we estimate causes of death, and that's where we would start estimating ischemic heart disease. So if we are very confident about our mortality estimates in a particular part of the world, there's no reason I would think that data availability would mean that health burden from ischemic heart disease would decrease. Right? Because that envelope is still is pretty secure. I mean, we can certainly poke around. I mean, I'd said, oh, I do wonder if there's any other risk factors that might match this. So we have high LDL, lead, smoking, high body mass index. I wonder if body mass index might have something to do with that. If I go to risk, let's just check out some of the other. Gonna go to summary exposure value here. So that's pretty flat, high LDL, smoking, a little bit of an undulation there, but not as dramatic. What was the other one we had? High BMI, high body mass index. No, that's also increasing. So none of the major risk factors that we have explain that curve. So I would imagine as my initial hypothesis that it might be due to disruptions in like there was a massive shock to the health system when the Soviet Union disintegrated in the 90s. That would be my best guess.
Okay. Well, if there are no further questions, we will close the session. Again, thank you everyone for attending. We really appreciate your time, and we hope you found this a useful presentation to helping you learn how to use GBD Compare for any research or evidence-based uh, activity you have going on. So thank you everyone for your time, and we hope you have a great rest of your day.
And same for me. Thank you so much for your time. Really appreciate it. Loved all the questions. Hope you, like me, have fun using the tool and learning something fun today. All right. Thank you all.
Bye, everybody.